seeing some of the great surgeons operate, seeing the tissue respect. Here is a
Tissue
specialty.
respect. I'm
Yes.
sorry, I will repeat that sentence. It's a
No, it's
tissue
absolutely-
respect. I've
it's
never heard this word from
absolutely-
any of the doctors yet.
Absolutely fundamental to surgery.
Wow.
Is how you respect the tissues, how you deal with them. So plastic surgery is kind of the pinnacle of
I mean, who can imagine a renal transplant to be done by a plastic surgeon? Nowadays, people are thinking just plastic surgery is just putting the Botox, fillers, doing a bit of,
I know,
flap here and there.
Unfortunately, it has come to be perceived as such, but still I'm happy to report that the global world of plastic surgeons, we are all active. The majority of them are making, phenomenal contributions to the progress of medicine and to help mankind. It's not Botox and fillers. That's what one little teeny bit aspect.
What exactly you think falls under umbrella of plastic surgery?
This world's first sort of biosynthetic reconstruction of a shoulder. This was accepted for presentation in the third triennial of the International Hand Society, which I presented in Delhi.
Wow. I'm lost with questions now.
So this is the beauty of plastic surgery.
This is extremes of reconstruction. Normally in hospitals, like when doctors, they come across doing any surgeries, I mean, layman people, they don't know that what plastic surgery plays a role. But any surgeries, I've seen doctors saying, okay, just involve a plastic surgeon also. In this surgery, involve a plastic surgeon also. So they call them, but they are hidden at the back. Patients, they don't realize that there is someone at behind fixing or assisting or, putting things together along with the surgeon.
I also think that plastic surgery can offer a fire service or rescue service.
What does that mean?
Plastic surgery was born out of war. Did you know that?
No, I'm not sure of that. Welcome to Med Talks by Dr. Anita. Dr. Mohan Rangaswamy is a highly accomplished plastic surgeon with over 3 decades of experience, known for his expertise in both reconstructive and aesthetic surgery. He is recognized for pioneering several innovative techniques, particularly in complex procedures, using plastic surgery techniques. Dr. Rangaswamy's approach is deeply patient-centered, focusing on restoring both functional and aesthetics to enhance quality of life. He has trained under global renowned surgeons and is committed to advancing the field of plastic surgery through education and research. He is a true generalist, touching into all the aspects of plastic surgery and reconstructive surgery with aesthetics. He has made a contribution in the emerging field of regenerative medicine. I'm keen to start the conversation as soon as possible since his vast experience will leave us short of time. A very warm welcome to Dr. Mohan Rangaswamy on Med Talks by Dr. Anita.
Thank you for inviting me to this wonderful channel. Although this is my first, I
Yeah.
hope we will have many more meetings.
Pleasure is all mine, Dr. Mohan. I was so excited. I'm sure you are quite occupied doing surgeries and procedures. So I wanted to bring you out on this platform. So I'm excited to have you. Thank you so much for coming on Med Talks. And my first question with you will be like, what exactly inspired you to get into plastic surgery? What was that thing?
Oh, we will have to go back many years. When I was a medical student, one of my colleagues got his finger inside the door and his fingertip got cut off. And of course, we were medical students. We were worried for him. We rushed him to the hospital. And after an hour of procedure, he comes back with the finger intact. And it was almost magical. We said, how come? He says, Dr. Satyaprakash, he did something. So I asked other senior surgeons, what did Dr. Satyaprakash do? They said, he's an eccentric man. He has some techniques. That was the perception in the 70s and 80s.
Whoa.
But this man was ahead of his time. But that little finger case inspired me. I said, this is magical. This is like the lost tissue is back again.
Wonderful.
And then fast forward to my movement to All India Institute of Medical Sciences, where I was in the endocrine surgery department. Even over there, some degree of head and neck cancer reconstruction used to be done because, as you know, in India, there's a big load of, oral cancer. Then I moved to the other unit, which is also general surgery, but it is called as the unit of reconstructive surgery and renal transplant.
Oh, wow.
Very strange. General
Strange.
surgery
Never
unit
heard of.
doing reconstructive surgery, microsurgery, and kidney transplant. But not so strange if you know that the first kidney transplant was done by Joseph Murray, who's a plastic surgeon.
Yeah, I heard of that.
He got the Nobel Prize for it.
Yes.
Right? So because plastic surgeons move tissue from one place to the other, and he moved a kidney from a identical twin to another identical twin and joined up the vessels, and lo and presto, the kidney function.
That's wonderful.
So over there, I saw a lot of magical things, especially with microsurgery. And things were very exciting. And we would read about a procedure, and next week we're doing that procedure. So having been a fully trained general surgeon, I saw that plastic surgery is an emerging field. And there's a lot of scope there, a lot of new things happening, exciting things. And plus, in plastic surgery, you are molding things. You are constructing, you're building magically before your eyes within 2-3 hours. You are creating something that was not there in general surgery. In general surgery, much of it is
You just fix it up.
removal.
Yeah.
Appendectomy, gallbladder cholecystectomy,
Yeah.
gastrectomy,
All removal.
everything is much
Nothing
of it.
putting back.
Much of it is ectomies. I said
Yeah.
ectomy and khalas.
Right.
But here we are building. So maybe that appealed to my senses and sensibilities. And also it's not restricted to one part of the body, not one region. So, my strong point is anatomy. And I didn't want to be exclusively in one anatomical territory because I thought all my other education will go to waste. Here is one surgical specialty where I can put all my education to use.
You always like to be out of boundaries. Huh? You don't like boundaries.
Well,
Have
in
to
a
be
way,
everywhere.
in a way.
Like
in a
how
way.
you're everywhere.
And then I saw one wonderful, pediatric surgeon, because when you deal with children, you got to be very delicate with your hands and very precise. And Dr. Penna, who's acclaimed for his innovations in anogenital malformations, he was doing his surgery with a dithermy pencil, which he was sharpening frequently, and it was so precise, it was magical. So
Wow.
seeing some of the great surgeons operate, seeing the tissue respect, seeing that here is a
Tissue
specialty.
respect. I'm
Yes.
sorry, I will repeat that sentence. It's a
No, it's
tissue
absolutely-
respect. I've
it's
never heard this word from
absolutely-
any of the doctors yet.
Absolutely fundamental to surgery
Wow.
is how you respect the tissues, how you deal with them. So plastic surgery is kind of the pinnacle of that. So I think bunch of these factors, put them together. And at the end of my senior residency, again, crossroads, what do? Are you a general surgeon? You want to be a kidney transplant surgeon? Because I had equal expertise in kidney transplant also, having worked in that unit. But then I decided it should be plastic. And so I went on to do my MCH from PGI Chandigarh to get the official recognition. And then that's how I became a plastic surgeon.
I mean, who can imagine a renal transplant to be done by a plastic surgeon? Nowadays, people are thinking just plastic surgery is just putting the Botox, fillers, doing a bit of,
I know,
flap here and there.
Unfortunately, it has come to be perceived as such. But still, I'm happy to report that the global world of plastic surgeons, we are all active. The majority of them are making, phenomenal contributions to the progress of medicine and to help mankind. It's not Botox and fillers. That's what one little teeny bit aspect that gets overblown because of the marketing and the commercial potential and all that. But really, truly, plastic surgery, as we shall see, is an important specialty.
Right. So going with the flow, I want to understand plastic surgery. Some people understand it's aesthetics, it's fillers and Botox. Some say it's burns and injury-related stuff. But what exactly you think falls under umbrella of plastic surgery? I mean, what exactly it means? What it encompasses?
Very difficult to define. This is always a question raised. What is plastic surgery? How do you define? How do you define plastic surgery?
True.
I'll make an attempt. Nobody has come up with a perfect definition of plastic surgery.
Whoa.
So that tells you a bit.
Yeah.
But let's look at it this way, that plastic surgery deals with anything where our skills are needed. Again, that doesn't tell you anything much.
Exactly.
So here is the thing. I'll attempt.
Yeah.
So if you have a situation where the tissue is either badly infected, that tissue is being lost, or there is a cancer, and for treating the cancer, you have to remove huge amounts of areas. There's been a complex trauma. So tissues are exposed, tissues are lost, there is a deficiency, all right? Or there are some situations where a functional restoration requires movement of tissues, all right? Or it requires some delicate work to be done. Mostly on the superficial parts, skin, deep to the skin, musculoskeletal, we even reach to the bone, but maybe we don't get into the chest cavity, we don't get into the brain cavity, and we don't get into the abdominal cavity.
All right.
But everything around the brain, in craniofacial surgery, plastic surgeons have made huge contributions. The entire field has been born out of plastic surgeons, in collaboration with neurosurgeons, of course, that the entire field of craniofacial surgery, where we are able to mold the shape of the head in complex trauma, complex tumors, etc. So as you can see, it's not restricted by area, not restricted by body, organ. It's not restricted by pathology, what happens to the tissues, what disease. It's not restricted by disease. It's not restricted by age. It's not restricted by anything.
Right.
It's unbounded. So where you need those special skill sets, Let's take a wound. It's not healing. 1 month, 2 months, it's not healing. Who's going to heal it? Then such cases get referred to plastic surgeon. So how is the plastic surgeon doing anything different? He starts reading the wound in a different way. So we look at tissues, we look at problems in a different way. See, problems are not problems for us. Problems are opportunities.
Opportunity for us.
All right. So, and also our training makes us to analyze the problem in a systematic way. What is missing? How much is missing? Where is the excess? Where is the deficiency? What can I move into this area to sort it out? And so on. So our way of thinking is different. So I think fundamentally what sets a plastic surgeon apart after his training and experience is his way of thinking and approach to a given problem.
Wow.
Can I give you an example?
Of course, I'm here to hear you out, and everyone has to hear it.
Okay. So there's a young man, Muhammad. He gets injured in Darfur. You know, a decade and a half back, there was a conflict in Sudan, and there was a lot of civil war. And in an area called Darfur, there was a lot of fighting. And, this guy becomes an innocent victim of a shrapnel injury. The shrapnel hits his shoulder gets blown away. And he's on the field left to die. Somehow somebody rescues him. And then since then, he's trying to fix his shoulder. The funny thing is his hand works, his forearm, and the lower part of the arm is okay. The upper part of the arm, the humerus, the bone of the arm is gone. The shoulder is gone.
Okay.
And it's just attached by some soft tissue on which somebody put a skin graft. So it's painful to him.
Right.
He's really suffering. 8 years. He's gone from one African country to the other African country seeking treatment. Finally, he comes to Dubai because his uncle is here. And then he goes to multiple hospitals here. Finally, he landed up in Wellcare Hospital with the orthopedic department. And the orthopedician then looked at him, took all the x-rays and all that, consulted with his consultant in Nottingham in UK. And the consultant over there, he said, like, nothing can be done. This case is like lost case. So the patient was going to be sent away. Yet another disappointment. But before sending him away, and I'm glad this happened, he said, just go and see Dr. Mohan. And I called him immediately after I saw the patient. I said, like, can't you put in a long prosthesis and, can't we rebuild his shoulder and all that? So he says, no, there is nothing there. And my consultant says it cannot be done. So again, when you see a problem, you want to see an opportunity. And I felt for this boy. I said, he's 8 years, he's roaming around and nobody is fixed. So I said, okay, let's dissect it out.
Right.
So I took this patient down to the orthopedic doctor. I said, what do you need in order to do a reconstruction of the shoulder? So he says there should be this other bone called glenoid capsule,
Right.
which was there, little bit was there. He said there is no acromion, there is no capsule structure, joint capsule is missing, this muscle is missing, that muscle is missing. I said, okay, I started writing down, okay, A, B, C, D, 8 things are missing. So I said, okay, let me think about it. And if I can provide these
bringing
things,
goosebumps on me.
will you do it? He said, maybe.
Wow.
So I made a plan. Now, when I left plastic surgery residency, you get the testimonials from your consultant. One of the consultants wrote, he has too much imagination. Too much imagination. So
wonderful.
I made an imaginative planning. I looked at the literature. Nothing like this has been done before, but some steps that I was planning had been done. There was some evidence that it might work. Some of the other things are logical extensions of well-known methods. So we put all this together and we built a shoulder.
Wow.
Using a regular long stem prosthesis, and I made the glenoid deeper using a neurosurgical burr. We put them together as a joint. We made a joint capsule using a hernia mesh. We covered it with a latissimus dorsi, that's the muscle from the back, transferred to now work as a shoulder muscle. So it's a functional transfer of a muscle and skin. And another muscle which was hiding away, retracted, I brought it forward and extended it by a tissue taken from the leg. And this was
unimaginable. I mean, I cannot even imagine you imagined it. It's
slightly crazy
incredible.
Plan. It was a slightly crazy plan, more than a crazy plan. But if you think about it, there is a chance for it to work. Okay, what is the other option? There is nothing.
Yeah, true. I mean,
there
just
is
leave
nothing.
it.
This was such a remarkable success.
Wow.
But he couldn't stay because he had already overstayed, and within 3 weeks, he had to leave. So we couldn't do the physiotherapy, etc. So we just explained some things to him, what he should do. Then he was lost to follow up. I keep calling him every month and he's totally lost to follow up. 4 years later, I got a call from Jordan.
Mm-hmm.
Somebody calls me And he says, there is this Muhammad blah, blah, blah here. And he said, how come he's in Jordan? What happened to him? He said, he's in an accident. I said, what about the shoulder? He says, no, shoulder is okay.
Oh, okay.
Shoulder is okay. He's got some other minor injuries. I'm treating him. But then I examined his shoulder and I saw the x-rays and all that. This is remarkable, beautiful. It's such a fantastic work. I've never heard of it. I said, please send me x-rays. Send me CT scan, send me
So
whatever you
sweet.
can. He said, I'll send you everything. But first he sent me x-rays. After that, I keep calling that number. No response. Then later, after 3 weeks, a nurse picks up and he says that doctor was diagnosed with cancer and he's undergoing chemotherapy and treatment in so and so.
Oh, that's so unfortunate.
And that particular patient has already left the country. So at 4 years, I get a follow-up with perfectly looking x-rays and a statement from the doctor who said, like, the abduction is this many angle, flexion is this many angle, and he's basically okay. He's basically using his shoulder. Again, we tried to keep on contacting him. Impossible. After 6 years, we got one brief blip of a contact. And I spoke to him. And I said, I will pay you the ticket. Come, let me evaluate you. He says, no, I'm okay. I have no problem. And are you employed? He says, I'm employed. I'm a laborer or a worker in a garage. And I'm able to lift things and all these things. Oh, no, sometimes in winter, it hurts a little bit. Otherwise, I'm fine.
Wow.
So this is world's first sort of biosynthetic reconstruction of a shoulder. This was accepted for presentation in the third triennial of the International Hand Society, which I presented in Delhi.
Wow.
So this just gives you an example of what I just told you.
I mean, I'm lost with questions now.
So this is the beauty of plastic surgery.
It's beautiful.
That you can analyze a problem into its components and be able to move tissue and also use synthetic tissues, synthetic materials, put them together where it is necessary and try and work out a functional solution for a problem.
This is extremes of reconstruction.
Yes.
Normally in hospitals, like when doctors, they come across doing any surgeries, I mean, layman people, they don't know that what plastic surgery plays a role. But any surgeries, I've seen doctors saying, okay, just involve a plastic surgeon also. In this surgery, involve a plastic surgeon also. So they call them, but they are hidden at the back. The patients, they don't realize that there is someone behind fixing or assisting or, putting things together along with the surgeon.
I also think that plastic surgery can offer a fire service or rescue service. What I mean by that is, let's say there is a cesarean. Everything goes okay, but the wound opens up and it's infected, and after some time, the baby is born. Baby is okay. Mother is sort of okay, but there is a big wound.
Right.
Now that's a problem.
Right.
So, whom do you call? Like they say, the Ghostbusters. Whom shall we call?
Who shall we call?
So call a plastic surgeon, because then he can sort out the wound. So there are many situations. There is an orthopedic trauma. Let's say the overlying soft tissue is gone. The bone is exposed. Bone is fixed. Plates and screws are now exposed. Now this is not going to heal.
Right.
This might end up in an amputation. Again, a plastic surgeon salvages the situation. So we do this kind of salvage work also, especially in related to orthopedic injuries, especially high velocity injuries, explosive injuries, war. Plastic surgery was born out of war. Did you know that?
No, I'm not sure of that.
Modern plastic surgery was born in World War I and particularly in World War II.
Okay.
World War I because there was trench warfare. In trench warfare, the soldiers dig trenches, go into it, only their head is exposed, or actually they are completely below ground. They pop their head out, shoot at the other guy, and duck back.
Okay.
So everybody is shooting at the opposite trench, and what is getting exposed periodically is the head.
At the head.
So these patients get shot on their head, and the rest of the body is okay, and they are evacuated. Now what do you do with this half the face blown off?
Oh.
He's drooling, he can't swallow, he can't eat. He's disfigured, to say the least.
Right.
So there is a whole lot of people with the faces blown off. Otherwise healthy men, heart, lungs, everything, body,
Everything
is all
is okay.
normal.
Right.
Brain is working,
Right.
eyes are okay. What do you do with these people? The then surgeons didn't know what to do with these people.
Okay.
So they formed
That's where it came up.
They
huh?
formed a committee to say, let's work on solving these people's problems. And Dr. Gillies, who's called Harold Gillies, is the father of modern plastic surgery. He was an ENT surgeon to start with.
Oh, wow.
And then he started looking at these patients together with a bunch of pioneering surgeons and developed ways and means to deal with them. Like each case is different. So they started developing principles. That brings me to another aspect of plastic surgery, and that is that you don't have set rules. You don't have set protocols, except a few conditions. You don't have the rule book to say, okay, if there is a gallbladder with gallstones and the patient is having pain, you remove the gallbladder. Easy peasy. But here you have a problem. You may do this, you may do this, you may do this, or you may completely do this.
Right.
You
Out
can
of the
come
box.
up. You can come up with, as they say, there are 9 ways to skin a cat.
Right.
So you can come up with 9 different plans. And this is the beauty of plastic surgery, that if you have a treatment planning session and there are 10 people, consultants and residents, and everybody will examine the patient, each one will come up with a different plan and try to justify
how
that
you
plan.
in an innovative way build a new shoulder itself.
Something along those lines. See, because you let your fertile imagination go wild. Try to take a broad view.
Right.
Try to think outside the box, but stay well grounded based on the principles and based on what works and what is expected to work, and what is too outlandish may not work or is maybe considered experimental.
Right. Is this a reason? I'm sorry, I'm
So,
interrupting.
yeah, sure.
I'll forget this question. Is this a reason because of which the ENT surgeons also land up doing some of the plastic procedures?
That's different. See, plastic surgery procedures, especially in cosmetic procedures,
Right.
as you can very well appreciate, is being done in different parts of the body.
Right.
Therefore, it may infringe on those specialties which are restricted to specific areas.
Okay.
Like if I'm working on the face or nose or whatever, I'm probably sharing space with an ENT surgeon. So the ENT surgeon is well within his rights to do a rhinoplasty,
Right.
with the only proviso that the person must be dedicated to understand the nuances of rhinoplasty and deliver a good job,
Right.
and not just do a rhinoplasty because I'm an ENT surgeon, I must do a rhinoplasty.
Okay.
Like that.
Okay.
And the vice versa also works. Just because I'm a plastic surgeon, I shouldn't go ahead and say, I can. You are licensed to do a rhinoplasty, but are you adequately trained? Have you got the expertise? Can you deliver a good job?
Right.
Ultimately, whoever delivers a good job, he can do
Is
it.
the best one to do that.
He or she can do it.
Right.
So there are areas where there is a bit of a turf war, to be honest, but I don't see it as a turf war if both of them can collaborate. I have collaborated with ENT surgeons. Till date, I collaborate with ENT surgeons because we have common area. Why not put our expertise together? I'm sure the ENT surgeon does a better septoplasty than I can do. He can harvest the cartilage very easily, and I can put that cartilage to use and do a rhinoplasty. I often work with eye doctors also on specific ophthalmoplastic procedures. Sometimes I'm in the gynecologist territory.
You're everywhere.
So this is another beauty of plastic surgery,
Yeah.
that you enjoy working with different colleagues, and if you do this, you start understanding their area of expertise also, and you become, it's an intellectual stimulation. See, we all start by being science students in school, then we become doctors. When you're doctors, you've gone through every specialty except plastic, of course. In undergraduation, there is no exposure to
Yes,
plastic.
there is no expertise in that. Yes.
So that's why a general doctor doesn't have much idea about plastic surgery, what a
Right.
plastic surgeon does.
Right. That's why I'm surprised to hear all this because,
Yeah,
I'm not.
So let's rewind back to the war.
Right. Oh, yes. Yes, we left it
So
there.
that is where the plastic surgery techniques were evolved. And then he wrote a famous book called The Principalization of Plastic Surgery. This book only mentions principles.
Uh-huh.
Like, to quote a few, for example, you must try to restore the beautiful normal. So what is normal? And normal is beautiful,
Yes. Wow.
if you think of it philosophically.
Yes.
So when you're trying to correct somebody, keep the beautiful normal as your ideal.
Statement.
And so things like that, like look where the deficiency, but also look where the excess is.
Excesses.
Simple thing, recreate the original deformity. So before we correct something, because tissue, body contracts everything and you get a contracted, post-burn contracture.
Right.
So you must look at fixed anatomical landmarks, and then you must measure distances, and you must then draw, and then you must if this contraction process hadn't happened, what would the original wound would have been? When you mark that out and you ask for original photographs if they are available, and they will match. When you release this contracture, the body will go back to the original deformity,
Right.
original size of the defect.
Right.
If you had not planned for that bigger defect, you would have underplanned. Your plan will fail.
Right.
So one of the fundamental things that we are taught as plastic surgeons is recognize the original deformity, recognize the original defect and the elements thereof. So again, principles come in. So plastic surgery is full of principles. Based on those principles, you let your imagination, your skill, your expertise, your anatomical knowledge, all that play together. And that's how we come up with those kind of plans that we did for the shoulder.
Out of the box, my goodness, I cannot even imagine. I'm still into that. How did you do that? I mean, it's unimaginable. I can't even think of it. Creating a whole complete structure in itself.
That's another thing. It's called the Eureka moment.
Eureka moment.
You know Eureka, the story of Archimedes. The Archimedes principle. Okay. Shall I tell you the story?
Yes, please. But we have to cut it short because there is a lot to talk about.
Of course. Archimedes was a chief scientist or expert or whatever, philosopher.
Oh, yes. My bad.
For a particular king.
Right.
And the king had ordered the goldsmith to make a crown. And now the king suspected the goldsmith is cheating him and it's not pure gold. So he tells Archimedes, find out if this is pure gold or not. Because if Archimedes says it is not, that guy's head rolls.
Okay.
So Archimedes has this now responsibility. Now, if it is a square or a regular shape, you can use geometry and calculate the volume. And the weight divided by volume give you the density. Compare the density of that to the known density of gold. And if it doesn't match, there is a pollution. There is an adulteration.
Right.
How to find the volume of this crown, which is a complex structure. And it is so said that he was thinking about this problem and he got into a bathtub and the water spilled over.
Okay.
Equal to the volume of his body.
Right.
And then he got so excited by this sudden revelation that he's supposed to have ran down the streets naked, shouting Eureka, Eureka, which means I found it, I found it.
Oh, okay.
So what happens in plastic surgery, and this does happen often, both in reconstructive and in cosmetic field. Okay, let's say there is a problem, difficult problem. Okay, I listened to the patient, I looked at it, I did the measurements, I did everything. Do I have a solution? I have the beginnings of a vague idea of a solution, but nothing is crystal clear yet. The patient is looking expectantly at me. Okay, now the doctor will say, what's going to be done? The doctor is thinking, I don't know what to do. I really don't know what to do genuinely.
Right.
And if there are 4 other plastic surgeons, I bet that all those 4 plastic surgeons don't know what to do.
Right.
But that doesn't mean that we will not solve this problem.
We cannot do that, right?
We take pictures, we take all the measurements, notes. I tell the patient honestly, look, your problem is a tough one, but I have dealt
Solution
with tough
for
ones. No, I don't have solution for it. I'll think about it. I'll research it. I'll get back to you. From that moment onwards, one part of my brain is occupied thinking about it, pros and cons, making plan A, no, this doesn't work, plan B, refine the plan. So what happens, you keep thinking about it, you sleep, and then you forget about it. Next day, when you're having a free moment, you think about it. It goes on in your mind. And then one day, you get that eureka moment. It's, okay, this is what I need to do. And this plan is the best plan, and this is what is going to work. And we had that eureka moment in a patient 3 years back whose face was totally destroyed and burnt by somebody throwing acid on her.
Oh.
Her nose was gone, her eyes were gone, she's blind. So many things wrong with her. So we tried to build her up to a certain extent. Then she said, I want a nose and I want a cute one.
Oh.
So I said, you have no tissues in the forehead, no tissue in the arm, no tissue in the forearm. Like, where will I get tissue to make a nose?
Right.
I said, you make a prosthetic nose, and there's an excellent person in Dubai who can make it, spectacle mounted. Nobody will know the difference. Nobody will be the wiser, and you will have a nice nose. End of story. She said, no, I want a real nose, and I'm sure you can make it. I said, I'm telling you, it's like I have no plans.
Right.
No way how I can make it. He said, no, you'll come up with some idea. He had more confidence in me than I had in myself.
Right.
So I said, anyway, I know all the details and I know everything. So it kept happening in my head. And then one day, that eureka moment, I said, I know what to do.
Wow.
So she had a small patch of skin, good skin, in her forearm. So we put a tissue expander in that, expanded it. Then we made a nose on that forearm.
So tissue expander means it increases the size of the tissue.
It's a balloon. You place it inside and you go on injecting saline into it every week.
Okay.
So the balloon grows bigger and the skin over that grows.
Okay. So that you use it to...
The same way that a woman's tummy grows as the baby grows.
Pregnancy.
Yeah. So now at the end of delivery, you have lots of loose skin, right?
Exactly.
So same way when we remove this balloon, there will be excess skin available.
Right.
But using that excess skin, I made a nose in the forearm.
Wow.
By taking ribs and cartilage and then making all the framework. So now we have a nose, a real nose structure sitting on the forearm. Why on the forearm? Because it's a little bit easier to make in the forearm and the aftercare, everything is simple. So we let that nose mature for 2 to 3 months.
You build a nose on a forearm.
On a forearm, yeah.
Amazing.
This is called prefabrication.
Wow.
This is now
Again under plastic surgery.
it's known in plastic surgery that
Wow.
we and it's been done many times.
So building a nose
So the
on
nose was on
a
the forearm, and
forearm.
then later on we used microsurgery to transfer this nose onto the face and joining the artery and vein to the facial. Okay, in this Dr. Abizar helped me, and we did it together.
Oh, Dr. Abizar, the one who I shot previously. Yeah, he mentioned to me. I mean,
So it was a collaborative effort in doing the
Wonderful.
microsurgery.
wonderful.
And I like to mention here one Dr. Shahram. He's very good with noses. So he helped me in the prefabrication stage. You see, you should take help in such complex cases because everybody brings, their own expertise, their own point of view. And also, you can have a dialogue with the other person. You can have a bounce off ideas.
This
Sounding
itself
board.
takes you one more
Sounding board.
level up, Dr. Mohan,
Sounding
taking
board,
name
yeah.
of other doctors. I'm sure they are after you in this industry, but this is a huge
No, no,
respect. This
we are all friends.
increases your respect
No, we are
as well.
friends.
So
We are friends, and the world
I'm
is
feeling great to hear that.
world is big enough for everybody.
Yes, absolutely.
So that's how it was done. Yes.
So can you discuss, Dr. Mohan, what are most common cosmetic procedures if you come across? I know it's a very small part of your expertise where you're,
Okay.
you
Let's put it this way: that a plastic surgeon does reconstructive work, cosmetic work, hand surgery, and regenerative. So broadly, there are 4 areas.
right.
Okay. So the percentage varies. Like for example, currently in Dubai, where I am working, my cosmetic work is probably 80%, and reconstructive is probably 15%, and 5% is probably reconstructive including hand, and then the regenerative is another 5%. Let's put it that way.
What is exactly in regenerative?
So in regenerative, you're using body's tissues in a different way. For example, if I do liposuction and take the fat, but then I inject the fat to correct a problem somewhere else. Like let's say there is an injury, there is a scar, and the area is painful and sensitive, and there's no tissue padding over the bone. Okay,
Right.
the patient is not is very sensitive to trauma. There, the skin breaks down at the smallest excuse.
Right.
We inject fat there. Now here, we're not trying to correct the shape or something. The fat has a specific purpose of bringing new cells to rebuild the tissues in that area. So we are regenerating. Okay.
Wow.
So this is regenerative use because the fat contains stem cells. So basically we are using stem
This
cells.
clicked my mind basically, like how we preserve the stem cells to do this stuff. I mean,
Yes.
so in liposuction, you use that.
So from the year 2001, precisely
2001.
1. So 23 years now, the plastic surgical world knows that fat is the fat tissue has stem cells. Okay, so this was a seminal paper by Zook, and in her paper she had brought forward this concept and this fact that there are stem cells in fat.
So we can use that.
And that fat is one of the richest sources of stem cells, and we're using it every day.
Wow. So it's, even if you don't preserve the stem cells, I mean,
No, you can take fat fresh from a person by a mini liposuction, and you have fat plus the stem cells. Either you can use the crude mixture itself, the full mixture, or you can destroy the fat cells and have the remaining non-fat cells, which is called SVF. And we can use the SVF, or we can send it to a specialized lab, and from the SVF they will only separate the stem cells and multiply it.
it has the same potential. Everything same.
The power of each of these is different. Like the purified, culture amplified stem cells obviously have more power.
Okay.
So in some situations we use that, some situations we use SVF, but the majority of situations we use unmodified fat as a regenerative.
Right.
So in fact, in year 2000 during pandemic, I had published in the topmost journal, which is PRS, a first time article on regenerative use of open grafting of fat.
Wow.
And I've just raised a gentle teaser that is it a substitute for flaps? Which means there was a patient with exposed bone. Normally, one would require a flap in the leg, for example. But the parents refused a consent for a flap, and they said, just do something small. We don't want further disfigurement for our child.
Flapping means taking one part of the skin,
Adjacent
fixing the other one.
Adjacent skin and moving it.
Right.
And then there will be a new defect where we will put a skin
Exactly.
graft.
Right.
But
So
without getting into the details, so I said, okay, I will inject some fat and maybe it will just help to promote the healing. Basically, I was buying time.
Right.
Till the parents can change their mind. But then at the end of the procedure, I said, okay, I have some extra fat. Why don't I just squirt it on the bone and cover it with a dressing?
Wow.
Now, this is serendipity, So next day I open it, and then the fat looks slightly pink. Then I put a negative pressure dressing on it. After 4 days, I open it, and this fat, which was yellow, is now red, and I scratch on it, and it bleeds.
Wow.
You don't expect that in 5 days, fat which has been just squirted on the bone will start
vascular
bleeding.
now.
It's
I mean, it's
vascular. It's
vascular.
got circulation going now.
Wow.
I've never seen this. I could never have
Wow.
imagined this. So this was a purely accidental discovery.
My this podcast is hypothetical. I feel I'm dreaming. I mean, such things
No.
happen.
I mean, it did
It's
happen.
beautiful.
After that, I have done 4 or 5 more cases. In each case, it was successful. So that set me thinking that am I onto something new with respect to the open grafting of fat. And so that was written up as a paper, and it was accepted, approved after all the due review process. And I even have histopathology showing the new capillaries coming into this fat. So that is regenerative medicine. So there's one aspect of regenerative. There's so much happening in the field of regenerative medicine.
Right.
So getting back to cosmetic surgery, I mean, it's from head to toe. It's facelift, it's rhinoplasties, it's facial beautification,
Right.
it's breast surgeries like augmentation, reduction. In each of these, I try to have a balance as to the best procedure with the most efficiency and safety, and trying to keep it simple.
Mm.
It's the KISS principle. Okay. So here the thing is, my focus is safety.
Your focus is safety. Yes.
So I choose procedures where I have the lowest risk of complications.
Right. What does it take to become a good plastic surgeon?
I think you should first of all have a sufficient grounding in science.
Right.
You should be a good doctor. You should qualify fully as a surgeon. This is my belief. This is my point of view.
Mm-hmm.
I don't recommend a half training in surgery and then immediately rushing to plastic surgery in a hurry.
Right.
You find that plastic surgery fascinates you after you've done your general surgery, because that grounding in general surgery is very important.
Right.
Then you do your residency in a good place. If you think that your residency was not at a very top place, then you are interested in specific subspecialty areas, you go and get further training on that. See, today things are easier, much easier. You have the internet, you have the knowledge, you have email, you can write to the people. People are more than willing to accommodate you,
Right.
given certain conditions.
Right.
So this was not there when I was in training. You know how the world was. There was no internet.
You still came out as a gem.
Internet came in 1995.
Yes, but you still came out of gem.
Whatever. I did what the circumstances allowed me to do. So I think today I would advise young people to take their time to get all the training and not be in a rush to sort of go out there and start practice and make money. Money will come. But I think that, you see, when you're young, your brain is more fertile. It is like a sponge. It can absorb
absorbs more.
You have more stamina. And I think the youth should not be wasted in trying to get into practice very fast.
Okay.
There is a rush. There is a certain rush nowadays
Yes.
to get there and make the moolah.
Restless.
But no, I think you should spend sufficient time. So that's what it takes to become a good plastic surgeon. It takes at least 10 to 12 years of training.
Dr. Mohan, what do you think sets your practice apart in the field of plastic surgery?
So I think because I'm doing both reconstructive and plastic, I'm able to take a broader view of things. And I have this feeling that I'm able to get to the root of the problem and trying to understand more fully as to all the aspects that are involved. Plus, I listen very carefully to the patient, and I make it a point that I meet with the patient at least twice.
Right.
And I don't encourage them also to rush into surgery after just one consultation, because we need to really understand. I try and use simulations whenever possible. Simulation is like, suppose somebody wants to do a rhinoplasty, we take the picture of the nose, do a computer simulation, simple one.
Right.
But we tell them that this is just to understand your mind. And then as I'm making the simulation, I'm looking at the patient and asking them, do you want this much reduction or more reduction or enhancement and whatever? So I'm looking at their response, and I'm also looking at their eye, because the non-verbal communication.
Right. Non-verbal.
The
It's
non-verbal
very
communication
important.
is very important.
Especially in plastic surgery, I think.
Very, very, very important.
Right.
And be completely honest. Give them as much information as possible. Not information overload, but sufficient information in a simple, no jargon way
Right.
that they understand. And the most important challenge is, I think the only important challenge in cosmetic surgery is setting the expectations right. Unfortunately, people have extremely high expectations, sometimes unreasonable expectations. A simple one, for example, that there will be no scar. Nobody ever said there will be no scar. No plastic surgeon ever wrote in any book that in this surgery there will be no scar. You have a cut on the human body, there will be a scar. Our job is to make the scar as good and as imperceptible as possible, and preferably in a hidden area. So these myths have to be broken. There's a whole lot of myths related to plastic surgery, born out of ignorance, born out of populism, born out of phrases that are thrown around in the entertainment industry.
Right.
Do plastic surgery change the face?
Change the face. Yeah, that's
this is,
hypothetical. I mean, it's crazy.
and it's good for Hollywood movies, but
Not in
that's
reality.
that's not reality.
Yeah, it
It's not
it has to be realistic.
So a lot of time that I spend is bring them back to reality. So I mean, I'm not saying that I'm the only one who's doing this. Any good plastic surgeon ought to do this, and I'm sure there are very many excellent surgeons that do the same.
Right.
So the only thing is, because I do all the different aspects and not restricted to one zone.
What was
so
the
it's a
three
broader,
hats?
broader
You were talking
area.
about some hats thing in our previous
Well, okay,
meeting, I remember.
you can say it's a populism that like so and so wears two hats. Here he is a CEO of a company, and there he's a musician.
Okay, that way. Uh-huh.
So in plastic surgery, if you are a comprehensive, well-rounded plastic surgeon, you wear multiple hats.
That is Dr. Mohan Rangaswamy?
Well,
Yes, you have to accept that.
So for example, I often tell patients, like I wear two hats. One is a reconstructive and one is cosmetic. So what is cosmetic surgery? Is you're trying to use plastic surgery techniques to enhance normal. Or address a specific desire of a person who otherwise is basically normal, no disease, no problems. Reconstructive is you're trying to bring a person who is affected, lost a part or whatever, back to normal. So from here back to normal, this is reconstructive. From normal to supranormal, just to use a
Supranormal.
phrase
Correct word.
would come in cosmetic, but there are a lot of gray areas. For example, a woman who has a huge breast, you can say this is cosmetic if she wants to reduce the breast, but she's suffering from shoulder pain, back pain, orthopedic problems because of this sheer weight of her breast. So that it's no longer just a cosmetic procedure, it becomes a reconstructive procedure.
Exactly.
But if she's got modestly enlarged breasts and she just wants to reduce them to look, perky or whatever, that is cosmetic. The surgery is the same. But depending on the intent,
Right.
it becomes either a reconstructive or it becomes a cosmetic, is based on the intent.
Wow.
Yeah.
In between the lines. So, Dr. Mohan, have you come across patients who come to you with some complicated case, or they come for a second opinion? Dr. Mohan, is this is right to do? Have I undergone a right procedure?
I do. And in fact, there are some online forums also where I used to spend time replying to these kind of second opinion questions.
Okay.
So second opinions and treating complications. These are intellectually very stimulating, because in a second opinion, you have to respect what the first surgeon might have told.
Exactly.
And sometimes they don't reveal everything, or they reveal something in a distorted way because that's how they understood it. Maybe the first surgeon didn't spend enough time explaining things, or they perceived it wrongly.
In different way.
Wrongly.
Right.
Okay. So sometimes when they describe things to me, I'm able to sort of guesstimate what the first surgeon might have told, what advice. And if that advice seems sort of okay, but it is misunderstood, I just clarify those things.
Okay.
I have a very clear principle of not to say anything bad about the other person, because I don't know the full story and I'm not here to criticize anybody.
Right.
Everybody, I believe, works to the best interest of the patient in front of them.
Absolutely.
And using their best efforts and knowledge and experience. So there may be different opinions. For example, in plastic surgery, there is no one solution for one
But
problem.
you're boss of plastic
But
surgery.
sometimes
I very rightly say that you're boss of plastic surgery.
sometimes the opinion may be way out, which I think is not appropriate at all. In that case, I just couch it in a different way and I say, look, my opinion is this is the best way to do this with this problem. You came to me for a second opinion. I've analyzed your problem. I think this is the best way for you. So there I leave it at that. Complicated cases, patients who have had complications are intellectually challenging in another way, because you need to figure out what went wrong.
Right.
You need to deal with the emotional baggage. So many people don't take a complicated case because you can kind of get secondarily involved. If there is a lawsuit, you get secondarily involved in that. So sometimes I have been hit hard by this, but the patient bundles me also into the complaint. So one has to be very careful, pick and choose which kind of patients that you want to take. Somebody who's already very vindictive. Like there are some red flags. Sometimes we don't always pick up all the red flags, but there are red flags are that she comes and starts praising you even before, you have even seen her and given an opinion.
Right.
And she starts bad mouthing the other guy.
Right.
So immediately this is a red flag, and she can go to a third person and bad
Talking
mouth you.
about you, exactly.
So I think such vindictive people who have an agenda, who are trying to get their money back and who are trying to do all these things, or for a small complication which is well within the realm of possible complications, she's making a big issue out of it. I think we should stay away
I
from
think you
that.
must be
away
coming
from
across a
that.
lot in plastic surgery.
It does
all this.
happen. It's a very difficult area. From the point of view of humanity, and from the point of view that you are a doctor and you want to help people, you want to take on such cases and try and help, especially when you see that, yes, the solution is inside, you know what to do to solve this problem.
You know why I am calling you again and again the best in this industry? Because the time when I came to Dubai, I had a scar on my hand because of
Okay.
my accident, which I had. I was 5 years old at that time.
Okay, okay.
So it's still there. And when I asked who is the best one in the industry, I was recommended to you.
Is that so?
And I
Okay.
waited for
Wow.
15 days. I forgot to tell you this. I waited for 15 days and then I got busy with something. I couldn't turn up to you. But yes, so this is the reason.
People are kind.
So, Dr. Mohan, the time is short. Just to have this one understanding from you, which, if I ask Dr. Mohan, which is your favorite procedure in plastic surgery, which you enjoy doing the most, what is that?
Difficult to answer again because because I do many things and many procedures are close to my heart. Let's say rhinoplasty, nose correction, I do enjoy because it's so nuanced and delicate work.
Right.
I do have a lot of contribution to the safety of abdominoplasty. So I do body lift or abdominoplasty. I started what is called lipoabdominoplasty back in 1995
Right.
when that procedure had not yet been published, let's say. So in
95.
this 95,
I'm remembering my age
so
at that time.
lipoabdominoplasty,
Yes,
and
my
I don't use drains. So I'm going
You don't use drains.
drains. Yeah, drains are
Those
tubes,
pipes to remove the
so,
blood.
So no drains in most of my surgeries.
Wow.
So lipoabdominoplasty, total body transformation using the principles of liposuction and safety.
That itself shows your expertise
And
with no
safety.
drains, a
So
procedure.
no drains. There are a few of us who don't use drains, but the majority still use drains.
Right.
But the world is slowly moving towards no drains. But no drains is not just that you don't put drains. It involves
has to be
many,
done in a way
many
that
other
it's
things
not
in such a
required.
way that it is not required.
Exactly.
As you say. So body transformations is another area where I'm good at it and I like doing it. This is in the field of cosmetic surgery. Now, of course, regenerative surgery is close to my heart, and for many difficult wounds, I'm using that. Any reconstructive challenge that comes my way, I do exercise my gray cells for it. So there's no one favorite procedure.
I am sure we have to come and meet again and talk about all these areas of expertise of yours. I'm sure the kind of experience
An
you
important
have.
area. An important area is the myths about surrounding plastic surgery. That will be a topic for another podcast.
Yes, of course. The time is short, and I'm sure we will have you again to discuss further on these topics. Thank you so much for coming to Med Talks by Dr. Anita, Dr.
Thank
Mohan.
you so much for this wonderful opportunity.
It was a great pleasure having you and being in the dreamy world of plastic surgery as well. Thank you so much. Thank you.